Are you wanting to be able to get into this position, improve your hip, knee and ankle mobility to help with range, whether to generally improve function and reduce the chance of injury, or for getting into a deeper squat position when in the gym? Then this is the video for you, where we'll be getting into exercises for how to improve the mobility in these areas. We had a request for this video, so if you've got anything that you want us to cover, then please leave a comment and just let us know. Hi, I'm Rob from AMR Physio, and I myself have worked on the journey of improving mobility in this area. Now, if you've ever seen a toddler in a squatting position, it looks pretty perfect and a very natural and comfortable position to be in. We are actually designed to adopt this position throughout life, but lose it because we never go into that position anymore, whether for a rest position or for going to the toilet. And pro tip, this is the best position to be in, anatomically speaking, to do a poo. In the modern world, we just sit on a chair to rest and we poo on a toilet. So we lose the ability to be able to get into this position, and see so many people today unable to adopt that position at all, where the foot is flat on the floor, the hamstrings touching the calf, and the chest is facing forward. I've been working on this myself for years and still struggle with keeping the lower back straight, but find it much easier to now use this as a rest position than I ever did. Now, if having that lack of mobility lower, that will work its way up through the chain of the body. If you've not got range at the ankle, the body will look for range at the hip or the lower back to be able to get into certain positions. Now, that's not saying that it's the cause for the increase in low back pain that we see in today's world, because correlation does not always mean causation. However, it would make sense that if you're forced into a position, if you have more range available to you, you're less likely to get injured when trying to do certain tasks. So increasing available range is only going to help things. This becomes even more important when starting to add weight, such as when in the gym and doing squats, for example. So let's look at the areas to work on and the exercises to help. Number one is the ankle. So starting at the ankle, this is mainly about being able to get into more dorsiflexion. A test you can do to determine if this is an issue for you is first see if you can get your knee to touch the wall while your toes are also there. Now, you want to be able to get your foot about half a foot length back while keeping your heel flat on the floor and still be able to touch the knee to the wall. If you can, you've got more than enough range and you likely don't need to work on the ankle. If not, then it's something that you'll want to work on. To improve this, it will be a soleus stretch for flexibility, just like you've seen, working to gradually get the foot further and further back, really working to improve that knee over toe position, making sure that heel stays flat to the floor. Now, a bit debated, you can do massage and foam rolling for the calf muscle. Anecdotally, a lot of people will say it helps, but there's not the best research to back it up. However, there's no harm in trying it to see if it does work for you. You can also work with the ankle in a similar position, but higher up for mobility work as well, but adding some overpressure on top of your knee, moving in all directions. It's not forcing this, but teasing it to increase position and movement. With any of the exercise that we're showing in the video, it all comes down to consistency and getting little gains over time. This can take months and months to make a difference. You can't just do this once and then perfectly get into that position forevermore. Slow, steady, consistent steps is the way forward. Let's look at number two, which is the knees. When we get to the knees, this is more simple. The same rules apply whether it's joint or muscle that we need to work on more, but it's all about getting into increased flexion. A good, simple exercise is sitting your bum towards your heels. Even better is having the top of your foot flat to the floor to help in general ankle mobility also. Now, if you've had a meniscal or ligament injury in the past or rehabbing your knee in some way, I'd be way more gradual in your approach to this when trying to get the hamstring and the calf together. If you feel like it's more muscle related, then you can just do a standing stretch more for the quad, or again, you can foam roll the quad to see if that helps as well. It's normally the hips that are more important though, because if you can't get your hips in the right position, you're not even going to have to worry about your knee. So number three is the hips. Working on hip mobility will also help with keeping the lower back straighter. If you don't have mobility at the hip, then it'll be your back that will round, that will try and increase that range. Now, I've worked on this a long time and still can't fully keep my back straight in the deepest position. But that said, it's way better than it was. Sometimes it can just be the case with people. When getting into the deeper positions, it can only improve to a certain point. Just because of the position of the pelvis might mean there's just no more space available. Keeping the knees a bit wider a lot of the time can help with this to free some of the space up, which means that any adductor tightness needs working on. But a lot of the time that still won't mean the ultimate perfect position, but that's okay. It's just trying to maximize it for you. It will mainly be ensuring the glutes and the adductors aren't tight when working on the hip mobility. But saying that, a really great stretch for overall hip mobility is working on the hip flexors, especially if spending a lot of the day sitting. So this stretch should be felt in the front of the hip and can be increased with lifting the arm up and a slight side bend. To increase this even further, you can move it onto a couch stretch, which can also start to help with the knee mobility. The ultimate with this is getting the heel to the bum and being upright. To work more on the glute and the adductor, you can again do some foam rolling massage as mentioned for the calf, but a great stretch for mobility is a 90-90 stretch, working the leg that's forward and trying to get your chest to the knee. If you can do that, you can increase this stretch by putting the leg on a higher level, letting the other leg drop down, and again, working to get that chest to knee or as close as able to and building into it. A nice adductor stretch that will incorporate the hip mobility is having the knee bent at 90 degrees and then threading the same side hand through behind to hold onto the foot. You'll have to work on keeping the hip abducted, and you will feel this in the adductor origin. You can intensify this by dropping the elbow further down towards the floor. Number 4 is thoracic. This is the final piece of the puzzle. Once getting the lower limb sorted, you can still end up with a really rounded upper back when in that position. So it's trying to work on thoracic mobility to help this. One of the best ways to actually work on this, if in that deeper squatted position, is using your elbows and your knees to feel like you're trying to bring your chest through and like you're trying to squeeze your shoulder blades together, working on trying to get that chest facing forward. You can also work on this with a foam roller, just laying on it, putting you into thoracic extension and using your arm overhead to increase it, or rolling through to increase it. When starting to be able to get into the position, it's then just working at getting more and more comfortable in it. With this added work and getting into those deeper positions, you can then gradually start to increase your tolerance of these positions working under load, such as squatting. And check out this video here if you wanted to know the right way to squat and how to effectively set up for it.